So maybe squinting to see or bringing that menu up to your nose to read may be the norm. And that might mean it's time for an eye exam. I'm joined by Dr. Riaz Ahmed, and we've been chatting about the importance of eye exams, something that I'm terrible at keeping up to date on, so I can't judge anybody else for not going. But you had said that it is important, and what makes it so important?
I think it's important to remember that just because you have good vision doesn't mean you have good eye health. And 1 in 7 Canadians with absolutely no symptoms will actually go on to develop a serious eye disorder. So it's important to remember to go in to have the health of your eyes checked regularly.
Now, does it matter what age you are when you go in? When should you start going to get your eye exam?
Yeah, and I mean, I think as a parent, you always think about all the things you do for your children, going to the pediatrician, to the family doctor. Going to the eye doctor isn't top of mind. And statistically, only 6% of parents think that they should actually be bringing their kids in for a 6-month eye checkup. But 6 months of age is when we want kids in for their first eye exam.
Really?
Yeah.
6 months? Well, 6 months seems quite young. Maybe not a lot of people should realize that their babies should have their eye exams. We do have a little bit of a video here for you. In this video, it's the typical baby eye exam. That's what we're seeing here?
Yeah, so this is a lot of people think that, you know, my kid can't speak. You know, what's the point of doing an eye exam at this age? But with our scopes and with our objective tests, we can test for nearsightedness, farsightedness, astigmatism, any opacity in the lens, or anything that might affect visual development. So at this age, the most important thing is to eliminate any barriers that could result in good vision. So it's important to remember that kids at this age and even a little bit older, they can't tell you if they can't see well. So a lot of these things are designed to test to make sure that we don't develop any problems such as lazy eye, which can't be treated at a later age.
Okay, so when you are, or you do have a child and you bring them in, is it once when they're an infant, and then how many years do you have to wait again? What's the timeline?
Yeah, so at the 6-month check, if everything's good, the doctor will generally tell you to bring them back at age 3, and then kindergarten, and then every year right up until the age of 19. It is covered by Alberta Health, so there's really no reason why you shouldn't be bringing in your kids at this young of an age.
Okay, so for adults, though, we can say whether we can see properly or not, and this is probably why I'm terrible at getting my eyes checked, because I don't feel like I have any issue, but regular checks still important?
Yeah, absolutely, and that's the other thing is that once you become an adult, everybody thinks they're invincible, you know, 2021, nothing's wrong, I can see well, but again, I can recall instances, and every optometrist will know those cases where someone came in just for a routine eye checkup and something was picked up that was really important to treat.
Really? Like, can you give me some examples of what you could find?
I have a patient that I can recall off the top of my head, 22 years old, came in for a routine eye checkup, no problems at all, and we diagnosed them with moderately advanced glaucoma at that age. So a lot of people think that that's a disease of elderly people, but it can happen at a young age.
Okay, so speaking of elderly people, how many checks should you get a year once you're an adult or a senior, or is it yearly, annually?
Yeah. So generally for contact lens wearers, we see them annually. For young, healthy adults, we'll see them every 2 years. And then once you become older, the risk of eye disease goes up pretty much exponentially. So after the age of 50, 60, we start seeing them again annually. And again, Alberta Healthcare does cover seniors, so after the age of 65, they are covered. But even regardless of coverage, it's important to monitor for eye disease. So diseases like glaucoma, macular degeneration, cataracts, all those sorts of things are important to look for.
Can be scary stuff, you know, just like going to the dentist. Sometimes people are nervous about seeing any kind of doctor. Tell me what people can expect when they come see you.
Yeah, so a routine eye exam will generally start fairly simply. We'll take some history, find out a little bit about you, find out what visual problems you have. There's objective testing that we'll do, and then of course everybody remembers the 1 or 2 test. So that's just a small part of the eye exam. The majority of it is spent looking at the health of the eye. And nowadays with our diagnostic imaging and the advances in technology, we can catch disease and more importantly treat it at a much earlier stage than we ever could before.
All right, very interesting stuff, very important stuff. Your eyes, of course. Important for me. I use them every day for work. To find a doctor in your area, you can visit optometrists.ab.ca. Thank you so much for being here with us.